Good afternoon. Actually, good evening, Christian.
Good evening, Eric. It is late as heck right now, but
It
we had to
is
do it.
a
It's just the
little
way our schedules lined up lately. But
just
how
the
are you?
way the cookie crumbles. I'm good, man. I'm good. I'm tired. Had to get up quite early this morning. Did some training at the high school. Exciting news, I guess, for us that we can announce because it is becoming official. We're hiring a coach, strength and conditioning coach for the business here up in Minnesota to be working with the high school athletes that I'm currently working at right now. And she's a previous student of mine. Her name's Katie. She's going to do fantastic. And we're super excited because this offers us more availability now, right? This gives us the ability to, put effort into other things as she starts to take on more coaching clients at the high school and improving the athletes there. And so it's exciting times as we continue to build and expand this project of ours that is Flex Metal. So other than that, though, just normal day at work, telling old individuals that they should be using a walker as they're falling in clinic.
Saving more
I,
lives every day, Eric.
I had one of those, literally my last patient today, walks in and she's like relying on a cane to like bear her weight. And I tell her every time the purpose of the cane, and she doesn't want to take her walker with anywhere because it's cumbersome and gets in the way. Meanwhile, she literally, I had to like catch her two different times doing like just walking on flat ground, like almost fell. And I'm like, you need to be better about this. And I keep telling you the same thing every single day, but that's all right. You know how it is. Sometimes people take it or leave it. It's medical advice.
Well, dude, the whole balance issue, it's a slow burn. So
It is.
as you know, being a physical therapist, we practice exercises every single day when demonstrating them for our patients. And we get quite good at a lot of different movements. And one of the ones that I've always been very proud with my skills is going to be single leg balance exercises with my eyes closed.
There you go.
But dude, the last I don't got it like I used to. I'm slipping. I just like I close my eyes,
Yeah.
like I'm good for like 5 seconds and then something happens. So I don't know
Yeah.
if it's because I'm like a bit out of practice or I'm not sleeping as much from the kid or I'm just
Mm,
35 and I'm getting washed. But I see your patient's plight. It's just like 1 year after the next, you just not doing the work you need to do. Next thing you know, you're 70 plus and you need a cane or a walker and you're almost falling all the time. And that it's
yeah.
being serious now, it's actually like pretty scary, like watching that
It is.
degradation happen, which we see, from seeing the same clients for several years, but like even within ourselves, just like the
Hmm.
old adage, if you don't use it, you lose it, is so true. That's why you and I are huge proponents of following the American College of Sports Medicine physical activity guidelines to hit your strength and your endurance goals, but also throw in some balance in there because you definitely need it.
Yeah. Yep. And especially as like to your point about trying different exercises or demonstrating them as a vestibular therapist as well. I demonstrate a lot of vestibular exercises, and there's some of them that like I'll do it, and after I demonstrate it, I'm like, crap, I'm kind of dizzy from that. Shoot, I
Yeah,
gotta
but you guys are like
gotta
doing this
sharpen
like
my.
all the time. Like how are you not gonna be dizzy?
I know there, and I tell patients that because they'll be like, "Oh, I'm kind of dizzy." Okay, now I'm good. I'm like, "Okay, I want you to know that if anyone came off the street and did these, like they'd probably have what would be called like a transient dizziness, right? It's there and then it's gone. You come back. But to even go further on your point about exercise, there, Christian, just a quick PSA about what is balance. Balance is made up of three systems in the body. It is your legs with the different joint receptors and the strength of the muscles. It's also your vision. So you use your vision or your gaze stabilization on the horizon to tell you where you're at in relation to the earth. And then lastly is your vestibular system, and that's in the inner ear, and that's going to also kind of calibrate you to the line of gravity and acceleration and all that good stuff. So, and as we get older, all three of those systems can get a little less efficient, and so it's important that we kind of come at it from a multi-system approach. But a lot of times I think we just think balance is like this one innate thing. And it's actually something that's made up of multiple, three different parts. So it's important to know that and work on that. But yeah, this is not a balance podcast, though. We have other things to talk about. But before we get into it, Christian, how are you doing?
I'm pretty good.
Anything new on your end?
Anything new? No. Physical wise, I am just trying to make sure I'm super consistent with all my training. So still climbing in the climbing gym 2 days a week, running 2 to 3, and lifting 3.
Nice.
It's a pretty rough spread, but I'm getting by. The hard part
Yeah.
is the I'm not sleeping 7 hours like I normally would
Mm-hmm.
because of the kid. I'm sleeping like 5 to 6, sometimes 6.5. And so I'm
Yeah.
finding that I think the lack of sleep combined with my age perhaps means my recovery isn't as ideal.
Mm.
I'm having to reckon with the fact that I can't progress really quickly or work really aggressively on all three fronts at the same time. And so I have
Mm-hmm.
to prioritize what to focus on. And right now I'm leaning more into pushing myself when I climb just to get to a certain climbing level. And then in the next month, probably push myself more with running because it's running season. Me and Bruiser got to compete. Then after that,
There you
it'll
go.
be pushing myself probably in climbing and lifting.
Nice. Yeah. Yeah. That's no, it's a good layout that you got there. Yeah, I've been taking the approach of like I've just been really busy with the business and my work and driving quite a bit. And so I've been trying to do basically my goal is to get in like three high intense like full body workouts a week. And so and like I try and switch that up between, like different cardio intensities, barbell, dumbbell, kettlebell stuff of just like, back I don't know, a couple years ago when I had more time, I would like go to the gym and I would do splits, 5, 6 days a week and really focus on different things each day and make it pretty specific. Whereas now I'm like, you know what? Let's just hit three good whole body workouts a week rather than trying to do like different splits. Um, and I've been finding that to be like, you just get a lot of bang for your buck. It's like I only have 40, 35 minutes to work out right now. And I'm just going to go really hard and do a whole body workout for the next 30, 45 minutes. And then, like, not stress too much about like being super intricate on like different splits or different um, programming parameters. It's more of just like, let's get the heart rate up, let's feel some good muscle burn, and basically, like, let's try and be sore the next day in like a good way, right? Get that DOMS to set in a little bit. But anyways, that's a good segue into what we're going to be talking about next, right? We're going to be discussing therapeutic exercise because both Christian and I, after our last podcast that we did on the new ACSM guidelines, we both kind of had some additional thoughts come about, and we've been looking into some different things around therapeutic exercise. And before we get into it, it's a good set the stage example of what I wanted to bring up. I was telling you about this pre-podcast, Christian, about there's a reaction video that we did, probably like a month ago about this group online. I think they have physical clinics, but I always see them like on Instagram, and it's called Next Level Physical Therapy or Next Level PT. I can't remember which one. And I keep seeing their stuff, and I've been just kind of biting my tongue the whole time. And I say that as if anyone really gives a crap of what I think or what I say, but I do feel like some of this should be kind of called out because I just think it's bad for the profession. I really do. They use a marketing ploy of where they take a video of one of their employees doing a very basic, simple exercise, right? That a lot of PTs give. If not all PTs have probably given at some point in their career, right? It might be just some simple ankle exercise when it comes to, working on ankle inversion or eversion, right? So like going out and in and like strengthening that in different ways. And they'll have a video of someone doing like this like perceived to be boring ankle movement, right? Maybe they use a band, maybe they don't, but it's perceived as being very boring and like lackluster and just not good, right? They kind of perceive or portray it to be that way, right? And then they show another video and it's the same employee or whoever it is doing some, kind of really extravagant type exercise where maybe they throw in some type of resistance or they throw in some different movement that is going to work that ankle inversion, eversion to the next level is kind of what their marketing ploy is, right? Like, don't do the basic PT stuff. Like, look how boring and, poor this is. Like, you want to do the next level. which is going to be here at Next Level PT. This is what we do. And for multiple reasons, I kind of have issues with this. And we'll get into it more when it comes to the therapeutic exercise discussion on the article that I want to bring up. But one of it is going to be one, therapeutic exercise is tough to study, right? And so a lot of the claims that they're trying to be based on research, they're basing it off of what is likely low to like very low quality studies. And so that's number one. Number two, when it comes to exercise prescription, it all depends on where you're at in the rehab process, right? If I have someone that comes in with a very, very upset ankle, I'm not going to give them, this weight bearing, heavy loaded, standing on foam, single leg movement. That's probably not going to go well. No, I'm probably going to give them some nice, easy open chain movement to get them started with their PT process, right? And then lastly, I think this is what's like one of the things that's really wrong with the PT profession and just strength and conditioning in general when it comes to exercise is this portrayal of like everyone else is doing it wrong and we do it right. And again, going back to the research, it's hard to say what is like definitively right or wrong, right? I have always said, Christian, there's no such thing as a bad exercise, just poor prescription, right? Whether it's poor timing, poor load, poor intensity, poor volume, whatever it is. And so what I would claim as being like a very egotistical standpoint that they take to try and market themselves, although I'm sure it's a great marketing tool, they're also putting down the profession of PT with it, right? And a bunch of other PTs that do great things. And so I just think that there's a certain level of accountability and consequences that come with that type of marketing that I want to be known. And just because an exercise might seem quote unquote boring or like not super fancy doesn't mean it's a bad exercise. And it doesn't mean it's not going to get you to the right spot, right? And it also doesn't mean that your PT that gave you that has ill intentions in mind or that they're stupid or they don't know what they're doing. They very much probably know what they're doing. They're very much having good intentions. It just happens that this is where you're at in your rehab process, and this is what's most appropriate for this time. And I'm sure that Next Level PT, I'm sure that they have good intentions as well. And I'm sure they have great physical therapists that work for them. I'm sure they do a lot of great work with their patients. It's just the style at which they go about it where I'm like, all right, we got to talk about this a little bit more because for me, it just doesn't sit right. I don't know. Find a different marketing campaign rather than putting down other PTs and other people within the profession. That's all I got to say.
I think that I actually have a pretty good example of what you're describing. So when I was in high school, I rolled my ankle really, really badly. I never got it treated. It hasn't been right ever since. And in the last, we'll say 6 months or so, I've been making a more earnest effort to try to work on my ankle mobility and ankle strength and endurance because I'm noticing it be more of a problem with my running in particular. And so I've been doing a bunch of fun balance exercises, and I got this cool balance tool that I like to use because it's very unstable. It allows me to work on the different angles of my ankle mobility. So I get the medial and lateral compartments of my ankle going at the same time. And it's actually felt quite nice. But I'm not making as much progress as I would have expected given the amount of work that I'm putting into with these balance exercises. And it's actually just before this call today, I was like, how about I just check out a band four-way? So band four-way is where you do the four cardinal movements of your ankle. You point your toe, pull your toes up, and you go left and you go right. I just wanted to see how I felt using like the black TheraBand, the classic harder TheraBand that we give out to patients. What does that feel like when I go into left and right or inversion, eversion? And dude, my eversion on my right ankle is like half as strong or half the endurance as my other ankle. It's nuts. I couldn't believe how tired it got by rep like 15 with on my first set of banded eversion. My other ankle got to 30, didn't really feel anything. So all these balance exercises I've been doing, all these next level exercises that are like, I would say very high level. I don't give them to patients because they're actually too high level most of the time. They're doing something. They're definitely helping, but sometimes you just have to do something really simple and targeted to shore up this underlying fundamental weakness that you have. Just this example of me doing this minutes ago just serves as a a reminder of you can't neglect the specific exercises that are required to rehab someone in place of the more like high level, specialized, general type exercises. You have to do both. Both are important. You're just going to figure out which ones that client seems to respond to or need most at that time. And that's going to evolve over time with their development and throughout their plan of care. So
Hmm.
now I'm going to start doing banded versions probably 3 times a week because I clearly need to do them. And we're going to see what the
Yeah.
heck happens with these balance exercises and how I feel with my running, of course.
Yep. Yeah, I couldn't agree more. Yeah, sometimes you just need to be targeted, and it might seem like a very simple, straightforward, boring exercise, but they can be very beneficial in the right time. So, anyway, that tangent leads perfectly into the article. So, quick background of the article is a systematic review, and do I have it? I do have it. As I'm discussing, let me pull it out. It is a systematic review of different exercise research articles, and they're trying to figure out what is like um, the optimal exercise prescription, right? Like what should we be doing? And so the review is called "If Exercise is Medicine, Why Don't We Know the Dose?" An overview of systematic reviews assessing reporting quality of exercise interventions in health and disease. This is by Hansford et al. This was published, when was this published? 2022, so about 4 years ago, so pretty recent. And one of the claims that they make is that, yes, we know that exercise is medicine. We know that, like, we promote that all the time, right? This is even bigger than PT. This is just general health, right? For individuals who might have some type of cardiovascular condition, or if it's diabetes, other metabolic diseases, we know that exercise can be very beneficial for those individuals and also preventing those things from happening. And so they dive into all these different research articles and they use a what's called an AmStar rating, which is just a rating to try and figure out, is this a good quality, is this poor quality, etc. And I'll just read you some of these off the list here. Critically low quality, moderate, moderate, low, 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 critically low, low, two more critically lows, a couple of moderates, and then a lot more low and critically low quality of studies, of research studies that look at exercise within different patient populations. So, anyways, that is the basis of our podcast today, is discussing exercise and exercise prescription and what we do with this information when the research behind it doesn't seem to be so reassuring. Christian, what are your initial thoughts with that? Kind of just the overview of the article that I...
Whenever I think about how to try to explain exercise to my patients, I try to liken it to something else that's pretty easy to understand. And my first thought when you were saying this, I'm like, okay, if we think about this as nutrition, we know exercise is great for the body. We also know eating whole foods and vegetables is great for your body. When it comes to figuring out for exercise, should you do this movement, that movement, how many sets, how many reps, what frequency? Sure, fine. Those are all things to think about. When it comes to nutrition, it's like, should you have 5 pieces of broccoli or 2 or 1 carrot or 4? It's like, yeah, dude, like you should just have broccoli and carrots. Like don't freaking sweat. Don't sweat how many pieces, just eat them. If you do that, if you just did that, you're going to do really, really well. With exercise, if you just do some movements, you did something, you're going to do really, really well. More is better most of the time, though. So I don't know. That might have been like a weird example to give, but like it just
I think it's
seems
spot on.
so stupidly simple. And like people way too often sweat the small stuff, and they're not even
Hmm.
doing the basic things. Just like eat a carrot, do a push up. Just like start there.
Yeah, right. I agree. What brought to my mind when you were talking about that is the analogy of a chef versus a baker, right? So a baker is someone that you have a very specific recipe. You got to add in the dry ingredients, you got to add in the wet ingredients, which, first of all, screw the person that decided what ingredients are wet and what ingredients are dry. Because there are ingredients that are, I know damn well they're dry. I can feel them with my hand. They are dry, and yet they're considered a wet ingredient. So you're either a baker or you're a chef, right? For me, I'm much more of a chef when it comes to my nutrition and my workout. right? A chef is, I'm going to add a little bit of this, a little bit of that, mix in some of this, we need our protein for the meal, so we're just going to get a lot of chicken in there, right? The main part of it, a little bit of these different spices, etc. And that's how I kind of look at working out, right? Like to your point, we know it's good for you. We just have to do it for one, and for two, we need the main ingredients of it, right? We need some form of cardiovascular exercise at a certain heart rate intensity for a certain amount of time. We need some form of compound movements at a certain intensity for a certain amount of volume, right? And then we can get, a little fancy with it and mix in some more accessory type movements and different things that are going to really emphasize what goals we're shooting for, right? And so I really like that analogy of a chef versus a baker. And I'll totally admit it. Sometimes there's people that I'm talking to about this, and they want every detail of what they should be doing to follow it exactly. And that's how they're wired. That's how their brain likes to look at things. And that's how they feel most motivated about things is when things are laid out very systematically, like you're following a recipe. Um, in which, if that's the case, then perfect. We'll do that. But at the end of the day, also knowing that like if we tweaked this parameter of your program a little bit here or a little bit there, it's not going to make a huge difference at the end of the day. And so, like you said, the biggest thing is starting just doing some of it, right? Eating that carrot, eating that broccoli, doing that push up, and just getting.
Well, that's why the study that you're referencing is comprised of so many low or critically low quality studies is everyone responds to exercise differently. There are
Mm-hmm.
so many other factors that go into why you decide to give someone an exercise in the first place. For example, I have a client who I'm seeing for gluteal weakness and gluteal tendinopathy. I saw her for like our fourth or fifth visit yesterday. She's getting somewhat better. I have her doing 2 glute exercises, dude. 2. She's doing side lying abduction isometrics for 3 rounds of 20 to 30 seconds, and she's doing banded clamshell isometrics for the same dose. I'm having her do that, I think, like 3 or 4 days a week. Would I like to give her more stuff to do? Yes, I would. I'd like to get her doing some more general exercise. I like her doing some kind of squatting pattern, maybe a hinging pattern. I'd like her to be doing some kind of cardio. But the truth is, she isn't going to do it. She doesn't want to. She's like, I want to do fewer exercises. I'm like, girl, you're on 2 for your hip and you have 3 for your ankle. You're doing 5 exercises. That should take
Yeah.
you no more than 15 minutes, a few days a week. But she wants fewer. Like, there's only so much that we can do with these constraints. And so people like this, which is like I'm not saying that she's a bad person or that she's wrong for feeling the way she feels. Like I want to be able to give you one exercise and say do it this many times and that be the only thing that you need. Sometimes it does play out that way and that's great, but it usually doesn't. It's not that easy. But people like this in a single study of like 20 people like that combined with more and more studies made up of the same heterogeneous mix of people is what makes up this study that you're talking about. It's like there's way too many things that go into deciding what to prescribe for someone that, yes, of course, I know that the dose of exercise that I'm giving that this woman in this example is definitely not ideal. It's not what I'd like to give her. I'd like her to also be sleeping better. I'd like her to get off her ass more because she sits way too much for work. I'd like her to just generally lose some weight if she could because she's definitely overweight. It's like there's so many things going into this that make these studies suck. And that's just the reality of our job. And if you are an athlete or a patient looking for that very clear, like this is the exact thing I have to do to get better, it isn't like that. We are,
Mm-hmm.
to your analogy, we are freaking chefs cooking shit up with whatever you're giving us in the moment, making things up on the fly. Oh, that burner just went out. Whatever happened. Like we just got to make do with what you're giving us, and make something really awesome happen. And sorry, but like I can't be a baker in that moment.
Yeah, right, exactly. We don't always have all the ingredients, right? All the ingredients to make it successful, and those ingredients are, yes, exercise is one, but time, sleep quality, nutrition, right? Other lifestyle factors are going to come into play and ultimately be a determinant factor whether or not the exercise is going to be super beneficial or have minimal benefit. right? The other thing that you were alluding to there, Christian, talking about your patient example, and I talked about this with multiple patients today, is consistency, right? There's a couple patients that I was seeing that like I went on their home exercise list and they've seen multiple PTs and like they've all kind of given their, variation of whatever exercise program that they're giving her or giving them. And like I go and open it up and they have like 10 different scattered exercises. And it's like, I can see why you might not be doing all of these because you, you have various things going on. And so I told them, I'm like, I don't want you doing 10 different things. I want you to be as consistent as we can with the big hitters, right? And so we boiled it down to five. I'm thinking about one patient in specific. We boiled it down to five really helpful exercises that they found to be helpful. And my message to them was just, it's about consistency, right? I would rather have you being consistent day in, day out, week in, week out, doing these five really good exercises versus, feeling like you have to get in 10 and you only do it 2, 3 times a week because you're otherwise too busy to do that or whatever it might be, right? Motivation behind it, whatever it is. So that's the other thing too, I think with this, when it comes to exercise that they didn't really touch on in the study, but is just overall consistency. I might give you the best recipe to make you successful and get out of pain. But if we're not able to stay consistent with it for whatever reason, and then it's not going to be nearly as beneficial.
Yeah, I totally agree. That's why in my example, I only gave her 2 for her hip and 3 for her ankle. It's like
Mm-hmm.
that is the amount that we mutually agreed upon as an amount that she can probably get done to a reasonable amount of consistency. And she isn't even doing that well. But like
Yeah.
thankfully things are moving forward. So like I'm hoping that it's going to keep getting better over time with the dose that she has. But
Mm-hmm.
that really is the chief issue with therapeutic exercise is that it is so individualized. You have to bring in all these different factors with what to recommend for someone. And studying it is an absolute disaster, which
Mm-hmm.
which is why you and I are huge, huge advocates for physical therapists also becoming strength and conditioning coaches. I'm not saying you need to become an S&C coach for a high school or a college or elite level athletics. You just need to understand the fundamentals of strength and conditioning because when you do that, you're going to learn those heavy hitters of what movements and what dosages and what adaptations you're trying to enact in someone and learn how to become a better coach, meaning get someone to buy into a plan that you're putting forth for them. And if you can do all those things really well with that knowledge and S&C, you're going to become a much better physical therapist and your patients are going to get better. They're going to get better
Mm-hmm.
more often than if you didn't take the time to learn that information. So,
Yeah.
and that's something that we're going to be doing with
Absolutely. Yeah. No, I would agree with all that. I think it's exercise because there's so many intricate parts to it. I think it gets blown out of proportion a little bit when it comes to like social media. And again, going back to my rant from earlier in the podcast, there's just so many intricate parts of it that people will undoubtedly, mess with it here, mess with it there, say that they have the perfect recipe for success when it comes to whatever diagnosis or whatever sport or whatever they're going to discuss. And in hindsight, we know that probably just isn't as beneficial as what it's made out to be, right? And the and we've talked about this for a couple of times, Christian, but like these are the tidbits of knowledge and the perspectives you get when you work with real life patients, right? I'm not saying that all people on social media don't work with, real world patients, but you can definitely tell those who work with patients in the real world and those who don't, because there's a lot of things where it's like, I'd love to see you try that in a really busy real life clinic working with the average American. And nothing against average Americans. I'm just saying it can be tough. And so, yeah. Anyways, neither here nor there. But yeah, I think that's a great summary though, like you said, Christian. Like the basis of strength and conditioning goes such a long ways. And I was actually about a month ago, I was visiting my old supervisor in undergrad down in Winona, and we were hanging out at his place and just chatting after dinner. And I told him, I was like, I think my education at Winona State with exercise physiology, nutrition, strength and conditioning, like I think that is the groundwork that was like perfect for me to go into PT school. Highly, highly suggest if you're an undergrad student or like a high school student listening to this for whatever reason, that'd be sick if you were, but and you want to get into PT, like take a strength and conditioning class, take an exercise science class or two, like try and do like I did a nutrition minor, like try and get in some nutrition classes. It helps so much understand the body, the physiology, and just like your rock solid foundation of how to prescribe exercise. It's so beneficial. And so, no. So yeah, and I would agree. Yeah, it's those are the things we'll be working with Katie on, and we obviously have our own outlook on things from strength and conditioning, as everyone does, right? But we know that it's more of that likely a chef analogy versus a baker, and guess what? They all work, and so it's a lot about that consistency and allowing that over time to give the benefit.
I think that was a good way to wrap it up.
Perfect. I didn't know I was going to be wrapping it up there, but as it came out of my mouth, I was like, yeah, this is a pretty good wrap up. So,
Nice work, Eric.
all right, Christian. Well, thanks for the podcast, man. It was fun to chat about exercise with you. And until next time, you have a good one, man.
You too, dude. See ya.
See ya.